Dr. Gerard Guillory. I'm a practicing internist in Aurora, Colorado. So I was trained as a medical doctor, did my specialty in internal medicine, been practicing about 33 years, and somewhere along the way I became interested in functional medicine and more specifically irritable bowel syndrome. And my interest in irritable bowel syndrome led to an interest in small intestinal bacterial overgrowth, or SIBO as it's also referred to, because the two coexist quite a bit. In fact, about 60% of patients diagnosed with irritable bowel syndrome actually have SIBO, or small intestinal bacterial overgrowth, as the underlying cause. So small intestinal bacterial overgrowth is when you have bacteria that migrate from the colon into the small intestine, where they really don't belong. So they take refuge in the small intestine, and as a result they ferment foods in such a way that patients get abdominal pain or discomfort, gas, bloating, and other digestive symptoms. It can lead to malnutrition because the bacteria in the small intestine rob you of your nutrients. Malnutrition and various nutritional deficiencies is another part of it. Well, I heard about it in medical school, but never paid too much attention to it because I thought it was such a rare disorder. Now I've got two siblings that have been diagnosed with EDS, or Ehlers-Danlos Syndrome, and then I really became interested. I think anytime you're in the medical profession and you have two family members that are afflicted with someone, then you're really interested in learning more about it. So Ehlers-Danlos Syndrome has lots of different varieties. The most common, which afflicts 90% of the EDS population, is the so-called hypermobility type. So basically the joints are hypermobile, or loose if you will. And it's a disorder that mainly affects the connective tissue, so the tendons and ligaments. And patients with this disorder, in addition to being hyperflexible, are predisposed to lots of joint injuries, and consequently they end up with a lot of joint surgeries. But it's not confined to the connective tissue in the bones and joints and muscles. It affects all the connective tissues in the body, including the connective tissue in, for example, the cardiovascular system, and the arteries and the aorta, and it also can affect the connective tissue in the intestinal tract. So it really is a multi-system disorder. I really think that it's underappreciated. You didn't hear much about EDS 10, 15 years ago, or at least I didn't, and I have an increased awareness having family members with this condition. But I do see more and more patients each week that come in to see us in our clinic, and they've been diagnosed with EDS by someone else. So I think it's becoming much more prevalent. Earlier that 90% of patients diagnosed with EDS have the hypermobility type, and there's not been a specific gene associated with that particular subclass of EDS. Now the other 10%, there's a lot of different subclasses, and genes have been discovered for each one of those different subclasses. So for the majority of patients with EDS, at least today, there's no established genetic factor. I think that's true so you can have the gene and not necessarily have the disease. They don't know the gene for the 90% that have the hypermobility type. And I think a lot of times you can have a gene and then there's some environmental factor that causes the gene to get turned on. And that's the science of epigenetics. So for example, you could have the gene for celiac disease, which is an autoimmune disorder that is related to gluten reactions. Not everybody with that gene has celiac disease. Only about 1 of the 25% who have the gene actually have celiac. So genes can get turned and get turned on. Ehlers-Danlos syndrome affects a lot of different organ systems. Most people think of it as a connective tissue disorder that affects the tendons and ligaments, making you hyperflexible and predisposed to orthopedic injuries. But about 60% of EDS patients also have digestive symptoms and small intestinal bacterial overgrowth, or SIBO. So it's not enough to just address the tendon issues. If someone with EDS who is predisposed to SIBO, they should also have those digestive issues addressed. That's critically important, that they, to the extent that you can try and maintain normal digestion as much as possible. I think it's absolutely necessary and helpful to have a multidisciplinary group of doctors and allied health professionals to help these EDS patients, which is very complicated because, as I mentioned earlier, EDS affects a lot of different organ systems, and it's nice to have someone that has an EDS interest that might understand the cardiovascular manifestations or might understand the digestive manifestations. I think the rheumatologists are generally the ones that specialize in treating the connective tissue abnormalities associated with EDS. But I think it's critical, very helpful to have a multidisciplinary team. I think it's important, no matter what medical condition you might have, whether it's EDS or some other relatively rare condition, become educated, learn as much as you can, and become your own doctor to an extent. But be proactive and look for information. And it's great we have the internet today. I guess it's good and it's bad, but at least it's a resource to begin to see where these centers of excellence are. And I think that's what they're trying to create here, is an EDS Center of Excellence. And hats off to them, and I wish we would see that sort of thing happen with more disorders.